Welcome to Uncomfortable by Design, a podcast with pro athletes, coaches, and the people behind elite performance. We talk about the hard moments, the pressure, the work no one posts about. Because real growth isn't comfortable, it's by design.
Hey, Dr. Colton, appreciate you coming on with us. We've been talking about this for a couple months.
Yeah, glad to be here.
Yeah, so we kind of wanted to dive into a lot of subjects and a lot of topics. When we were researching your background, we saw that you were a third generation, doctor of chiropractic care. Kind of give us the backstory of like how that happened, the family roots and whatnot.
Yeah, so my grandpa was a chiropractor. He since passed away when my dad was really young, so never got the chance to know him, but growing up, my grandma always had pictures of him with BJ Palmer, who is the founder of chiropractic. So he'd ride in the parades with BJ, which is a really cool piece of history there. And then my dad became a chiropractor, still practices out in Pennsylvania, Latrobe, Pennsylvania. So I grew up around chiropractic, always took it for granted growing up, to be honest. But when I decided that I wanted to go to school, I knew I wanted to do something in the healthcare field. Was kind of torn between surgery, physical therapy, or chiropractic. And after shadowing some local chiropractors, getting a better sense of what it really was, it really drew my attention and haven't looked back since. I have no regrets. It's an awesome profession to be in.
That's awesome. You rarely see a lot in this day and age where kids will follow their footsteps of their parents and their grandparents. So that's really, really cool. Tell us like what therapy in chiropractic care you specialize in.
Yeah, so we actually specialize in a technique called the Gonstead method. If you've never heard of it, I'll give you the brief history on what Gonstead is. So Dr. Clarence Gonstead, he practiced in Mount Horeb, Wisconsin. He started his first practice in 1939, practiced all the way up till he died in 78. And he grew one of the largest chiropractic clinics at the time, had really unique results. He was getting superior results to a lot of the colleagues in the profession. So people started asking questions like, what are you doing? How are you getting these crazy results? And the bottom line is he had a system of analysis, a system that he had developed over the years. He started as an engineer, transitioned into chiropractic because it helped him personally. And he had rheumatoid arthritis and some other underlying conditions. So chiropractic helped him. That's why he got into it and built this massive clinic where he had people traveling all over the world to actually come and see him. He actually built a runway with an airstrip and a hotel attached to his clinic because the demand was so high, and he would see 400 to 500 people a day, working 7 days a week, often 18 to 20 hours. So the amount of volume he saw in his clinic was staggering, and there's not many people in the profession even today that can amount to that kind of impact on what he was doing.
Wow, that's really intense. So it's, a little over like 90 years almost that this practice has been around, this therapy.
Yeah.
What's the differentiator between what people will see like on YouTube and social media on like the crack doctors versus like when they come into your clinic and what you specialize in?
Yeah, everyone loves the cracks. Everyone's a crack addict, but that's not what chiropractic's all about. Most people have the misconception that the popping and cracking is a good thing and that it's just for pain relief. Chiropractic is so much more than that. It's actually founded on the premise of having the nervous system functioning optimally. So it was never based on pain relief. The first chiropractic patient ever was actually, he had suffered deafness after he had a pop in his back, and D.D. Palmer had adjusted an area in his spine, and shortly after he started restoring hearing. So it had nothing to do with pain, but chiropractic just happens to be really good at pain relief. So that's kind of what took on over the years and decades after, and it's just one thing. Most people, if they want to seek care, it's for something disrupting their life, and pain is usually something that'll halt that. So chiropractic is great at pain relief, but the big difference with the Gonstead method is we have a system of analysis. It's not just we lay someone down on a table. We're actually going to go in there, take full spine x-rays, analyze those, know what's going on with your structure, your biomechanics, so we have a plan to actually improve that over the long run. I'll go over the couple of different other components there. The first one is visualization. As soon as someone walks in the office or sits in the chair, we're looking at their posture, seeing how their gait is, how they're moving, because that gives us tons of clues as to what's going on, what we need to address. And a big part of it here, I got our instrument here, it's called the nervoscope. So this instrument, actually, we run this up and down the spine. It detects the heat differential coming off the paraspinal muscles there, and there will be a quick deflection over any area where there's inflammation in the spine. So that helps us really cue in and figure out where's that nervous system being stressed out. So this helps us really pinpoint that. So we kind of combine all those factors and the symptoms that people are coming in with to determine what's the best course of care and what areas do we have to focus on to achieve those results.
Yeah, so I've been an athlete for a very long time, and most recently, CrossFit's been a big thing, part of my life. Pickleball, soccer. So I came to you after I had a big injury playing soccer and with CrossFit. And when I came to your guys' clinic for the very first time, we walk into, and you guys have a dedicated x-ray room, just a room where you stand, very non-invasive, very open room. It's not scary at all. It takes maybe all about 3 minutes. And every time I come into the clinic, you guys have a big screen TV that shows the actual x-ray scans. And I noticed that every time I come in for treatment, you always go back and look just to triple check and make sure that where the areas are. I think that's very unique because I don't believe from the multiple other clinics and therapies that I've been to in chiropractic care, you walk in, they have you fill out a form, and then they just start cracking you on the table. They don't really look for the center kind of root problem. So kind of like what drew you to the specific method? Like of all the chiropractic care, why the Gonstead?
Yeah, so it's a great question. To kind of cap on the x-ray portion that you talked about, a lot of chiropractors or providers that will take x-rays, whether they're taking them just to rule out any red flags to make sure there's no fracture, or they just take them to get a brief glance of what's going on with the spine, but they don't read them specifically. They don't analyze them to have a long-term plan over the biomechanics, what they want to do with the spine. And that's something that Dr. Gonstead was really good with. His whole system is based off of all these adjustments that we do. They're very specific to actually make sure we're actually making long-term changes to the spine. So that's kind of why we're always looking and referencing those x-rays, is because we want to make sure that we're adjusting that vertebrae or that hip joint in the proper manner. Because yes, you can pop a joint and make a lot of noise, but if you're not correcting it at the right angle, that's the difference between someone getting superior results and maybe just getting some temporary relief. But what really drew me to the method, I remember my first day going to the Gonstead Club at Palmer in Davenport, Iowa. The student that was teaching was kind of doing an overlay of the method, why we do things specifically. And he kind of called it out and said that, a lot of these classmates of yours, they might come in here, they might try it out for a day or two, but they're going to give up on it because it's hard. It's not easy to learn this method. It's not easy to read the instrument or make those specific adjustments, adjust someone's neck specifically in the chair with moving one vertebrae by itself versus popping the whole entire neck, which isn't ideal. But that's what really drew my attention was, hey, something that's worth doing is never easy. So why would I take the easy road and just do a technique that someone can learn in a single weekend versus something that takes years to master? So
interesting. And I want to point out while we're focusing like our podcast and kind of the population that we talk to is athletes of all different backgrounds, but you guys are a family care practice. So I brought everybody from my family to you. Like both my kids go. My son was like terrified because he had gone to a previous chiropractor. Very first experience was as he cracked his neck. And at the age of 8, he freaked out because you don't know what to expect. So every time I tried to get him to come to you, he's like, Dad, is he going to crack my neck? And I'm like, no, it's not like that. So, my son was dealing with a lot of ear infections. You guys did the x-ray scans and you had been adjusting him since now for well over a year, and we haven't had any issues since. So, and my daughter goes to you too. Both of them play high level, sports, and it's been a really important part of like our family care. So you guys specialize in women that are carrying, you guys specialize in kids, adults, athletes, not athletes, just kind of like give us like the scope of like anybody can come in, right?
Yeah, absolutely. We have lots of pregnant ladies in the office currently, and then usually when they give birth, we're checking baby within days of being born. So A lot of people don't think about that. The birth process is one of the most traumatic things we go through, and that's how most people start their life out. They have some sort of trauma that's never been addressed, and if that cascades into the years, decades later, where you've never had that treated, and it's just you have nerve pressure on the spine or you have some sort of misalignment in there, that can affect your whole trajectory of development.
Yeah.
So that's why it's important that people get checked early on. But yeah, we see babies all the way up to people over 100 years old. So it's safe for anyone. The specificity is what allows us to do that, making sure that we're only working on the spots that need to be adjusted versus everything that feels stuck. Because as we get older, obviously you're going to have arthritis, you're going to have restricted joints. We don't just want to go messing with the body if that area doesn't need addressed.
Right. That's really good to point out. So, explain kind of why the Gonstead method or your specific therapy treatments, how are they critical for athletes? And it doesn't have to be a professional athlete, but someone who, like myself, I do CrossFit and pickleball and soccer. Why is it critical? And why is it not critical for someone who's not an athlete as well?
Yeah. Specificity is important for everyone. You can get general results by doing all kinds of different things, but when it really comes down to athletes where milliseconds matter in your performance, just think of any unilateral sport where you have golf or baseball, for example, and you've been doing that for years or decades, and you just have those certain movement patterns where those muscles adapt to that, you're getting imbalances. Just a general approach isn't going to be able to address that. So we want to look at every individual person and figure out what their specific case is presenting there, so we can have a map or a plan to actually address their biomechanics and make sure that we're improving their function overall.
Yeah. Have you guys seen a increase in sport injury, and how many people come in here having said that they never have gone to a chiropractor before, and then it changes their perspective on this type of treatment?
Yeah, absolutely. I would say, especially with youth sports now, it's getting more and more competitive. You got parents that are putting their kids in camps, doing private lessons from a younger age. So that's where they just have more likelihood of having overuse injuries, having injuries at a younger age. A lot of the people that come in here, if they've had any kind of chiropractic experience, usually it started in high school. When they were in sports, they get injured, they go to the chiropractor for a short period of time till they get fixed up, and then they neglect it again till years later, or they have those previous surgeries where it's just constantly been nagging them, and they get to the point where it's disrupted their life enough they want to do something about it. But that's more of a reactive mindset.
Right.
You're doing it because you have to, versus if we proactively treat someone, let's say they sprained their ankle back in the day and never thought anything about it. If we can address that right away, those knee injuries and the hip injuries that accommodate that may never even happen. So that's why a proactive approach is always good.
Yeah, so I want to touch up on two things. One, you touched up on this, but how does alignment and the therapy impact speed, strength, and recovery when you do the treatment before it becomes reactive? Give us kind of the breakdown on why it's super important someone comes in, maybe not regularly every week, but once a month or what. How does that really impact results now, and then results also being able to recover quicker?
Well, I think one of the things in society, which is a good turn, is a lot of people are focused on the nervous system. They're doing the mindfulness, the breath work, all that stuff to optimize their nervous system function. But what's directly connected to our nervous system is our spine. That's what's protecting it. So if we have nerve pressure in a certain area and we're not addressing that, we're missing a big piece of that puzzle. So there's tons of studies out there in chiropractic where they'll do grip strength tests, the grip strength tester where you squeeze it and it tells you how many pounds.
Yep.
They'll do a pre and post assessment, and it's always higher after they receive their adjustment in the thoracic or cervical region there. There's lots of different sports-based performance research going on within chiropractic, which is exciting because it's just proving all the things that we've known over the decades, but never really had evidence to back it up. Yeah.
So the second piece that I wanted to touch up on that's kind of close, for something that I deal with every day. There's a epidemic in ACL injuries, particularly in women, very specific in younger women and girls of a certain age that kind of, start around the age of 12 up to your late 20s, early 30s. Give us how this can maybe reduce a huge sum of ACL injuries. Because I brought my daughter in. She was, she's playing 5-6 days a week, and then was also running track, and she kept complaining of some discomfort. And I think a lot of times I hear athletes say that they feel discomfort, but it's fine. It doesn't hurt enough to stop. But like, explain how to navigate this epidemic and how people can help with like your therapy.
Yeah. To address that, if you look at the research, a lot of people say the most commonly reported injury in athletes is knee injuries. But I would argue that's probably not actually the case. Think of how many people actually have sprained their ankle in the past that never did anything about it. The reason it's not more prevalent in the research is because it's not reported. It's a minor injury. Maybe the ankle was swollen for a couple days at a time or a week, and then they're back playing sports again. But when you have that misalignment in the ankle joint, it's gone beyond the capability of the ligament, so you get that sprain. You have swelling in the joint, it eventually dissipates, or maybe there's some residual swelling left in there, but their faulty foot mechanics are still there. So every step they take when they're running or planting, that ankle has a tendency to roll out even farther. That translates up into the knee, up into the hip, and that's where, unless it's a traumatic injury where someone directly crashed into their knee, a lot of times those planting injuries are what are causing the ACL tears. And I think a lot of that could be prevented if we look at the foot mechanics, the hips, everything else, because the knee is almost like the middle child between the two that often gives out, but it's not the root of the problem.
Yeah. And the knee's not designed, to move left and right. It's designed to just be kind of in one place. When should serious athletes begin care? Like, when should serious athletes start to come to get therapy?
Yeah. So in a perfect world, they would start young. Obviously, in my opinion, when they're babies or infants, just to ensure that everything's good. And that doesn't mean that you have to be on an intensive regimen your entire life, but at least being checked to ensure that there's nothing stunting your development or growth, especially as we get into those teenage years where you hit the growth spurt, or if someone has a curve in their spine or scoliosis, that's typically where you'll really start to see the effects of that coming in as well. So checking children younger on, especially if they're in athletics, is extremely important because they're just having much more stress and demands on their body.
That's such an interesting point. I've been hearing more and more, particularly from I coach mainly in the women's program and the young girls, high school age, and more girls have been saying they were diagnosed late with scoliosis. And scoliosis, I guess, can have different kind of like ways that it affects the body. And they never knew about it until they would say things like, oh, I couldn't get like a whole breath, or like it would hurt around my rib area. So, if somebody is interested, at what age should they really consider? Are we talking like ages like 10, like 8, like specifically, like when would you say if your kid is serious in sports, like you guys should start considering coming? Like, what's the perfect age?
Yeah, I mean, recently we had a young girl, her mom had scoliosis, so she was concerned. She's like, I feel like there's a curve in my daughter's back as well, which there is certainly a genetic component. A lot of times we see that through the generations of the family, but she brought her daughter in to be checked. She's 8 years old. So that's where we're working actively to prevent that curve from worsening, because she's getting to that point where she's going to be grown quickly soon. So I would say definitely adolescence is a great time. Typically, we don't take x-rays on children until they're at least able to stand and stand still at that. So typically 3 to 4 years old is about the earliest we'll take an x-ray on a child, but you can even see the signs as early as then. So it's the sooner the better. That way, the more adjustments we get on that early on, the easier it is to fix. When someone comes in and their scoliosis starting to progress and curve to 45, 50 degrees, that's where it's much harder to fix. It's much harder to address, and we want to avoid that surgery at all costs.
Yeah, and you bring up a good point. How much do genetics play a role in some of like what you see like now?
I think there is a large component to that, but I think a lot of the overlooked factors are the environmental stuff, what we're doing growing up, playing sports, that can have a huge effect on it as well. Because we have people that have a really severe scoliosis that function perfectly. They have no issues, no symptoms whatsoever. We got people that have almost a textbook normal spine that have tons of things going on. So it's ideally you want better biomechanics. You want the spine to be as close to ideal as it can be, but that's not the end all be all. There's many factors that go into that.
Yeah. So you mentioned something about reactive care. Reactive care is something I think the American society is very famous about, and that's, hey, Mom, my ankle has been hurting me for 3 days now, and they have a tournament tomorrow. What is the difference between reactive and proactive performance care? Well, you guys are really saying, hey, we want to be proactive, but everyone is known to come to you for the reactive kind of symptoms, right?
Absolutely. And we're in a reactive society. A lot of people don't do anything until the problem is there. And we fully understand that. We're usually the last link in the chain that people come to. Usually they go to their doctor first. They get pain meds or muscle relaxers. They send them to PT for 8 weeks. And if the problem still persists, then eventually they come find us. So we want to educate people that, hey, a lot of these problems can be addressed early on if we have a good understanding of what's going on with your spine, the rest of your joints, and we can adjust those, manage those conditions before they turn into a problem. You wouldn't have a lot of these issues that people have, or if they've gone and had surgery and now they still have back pain, they want to come in and they want us to fix it. We can do that, but it's going to take a lot longer. Had we done it earlier, we could have prevented that from ever having to happen. So that's the biggest thing.
Yeah, and it's kind of interesting because one of the things that I was talking to another therapist, physical therapist, about reactive care, chiropractic care and physical therapy are really seen as like the last ditch efforts rather than the first line of defense. And we kind of got into a bit of a intellectual discussion about this. Everybody thinks that they should go to a regular general practitioner, but when you go to a general practitioner, they're really not taught and educated on how to deal with these types of problems, injuries, or symptoms. And a lot of times you'll go and they'll tell you take ibuprofen or Tylenol for sometimes up to a week and see if the swelling goes down and then stretch. But that's such a lazy explanation, such a lazy form of care. And obviously there's a lot of people in the last 20, 30 years that got addicted to prescription meds for dealing with that. So why should this be the first line of defense? How can people feel more comfortable that they should come to you guys first? You guys can do a very thorough examination, thorough assessment, evaluation, and then say, hey, you know what? We can help, or you might want to go see a more trained specialist. Something else might be wrong. Give people the know-how how this should be the first line of defense.
I think the thing that makes the most sense that people can understand is it's a chiropractic principle in their philosophy is innate intelligence. So I know there's other forms of the word that all mean the same thing that are kind of recently been buzzing around, but innate intelligence means that your body has this inborn intelligence within that is governing everything. If you get a cut on your finger, it's not the Band-Aid that heals it, it's your innate intelligence. The body tells what cells it needs, it goes in and heals it. So any condition in the body is governed by that same principle. So a couple analogies, we all brush our teeth every day. Is that because there's a problem there? No, it's to prevent it. We work out to keep our muscles strong, not because they're failing us. So chiropractic is the same. It's a natural principle. All chiropractors are doing is simply removing nerve interference by restoring joint to that motion, or the motion to that joint so that it can move properly. Right. Your body does all the healing. So that is the bottom line. It just makes sense. It's the same as anything else that we do that's good for our health. It should be something that's normal in our routine. And if we can catch that before problems arise, you don't need to come in nearly as often. So that's the beauty of it, is a lot of people, they come in reactively. Yeah. And then they have a severe problem. It takes a little while to get those results because the body takes time to heal. So you can only heal as fast as your body's going to allow you to. But all we're doing is removing that interference so that is capable.
For sure. And this is going to be a hot take, but when I first came in here, and I've been, from my playing days and from sport injuries, I've been into I've been to general practitioner for regular Western medicine. I've been to other chiropractic care. when I walked into this office, you're a very fit guy. Dr. Brady's a very fit guy. You guys are very knowledgeable. You know, the whole front staff is like very fit, very knowledgeable, very young. It's so cliche when you go into a doctor's office and your doctor's like a dinosaur, and I don't think they work out. And you can't even relate to them like, hey, I was doing this and I felt this happen. They can't relate. They're so out of shape. It feels weird talking to someone who's out of shape and can't really even relate to like what it is that you were doing. And every single time that I've came into you, you were like, hey, what did you do this time? I'm like, well, I was doing heavy deadlifts and like it didn't flare up, but like it hurts a little bit. And you were able to ask like, what kind? Was it the hinge? Was it like a specific weight? Like you went in deep down into the layers of it. And for me, like that made a huge difference, like to having that connection, because I remember when I went in for my big flare up with my L5-S1 injury and I went to the doctor's office, he knows where the S1 is, but he couldn't even like explain to me, oh, well, what happened? Like, how did you do it? Was it like a specific movement? And he just told me to take ibuprofen for a week. And then if it doesn't get better, then to go get an MRI.
Yeah.
And so that kind of turns people off. And so a lot of people don't realize when they come to see you guys are fit. You guys are very knowledgeable. You guys are young. So you guys understand what modern day medicine looks like. And it's not, medicine from med school or from 30, 40 years ago, right? Like you guys really stay up to date. And I really like that you guys are in the like recovery and therapy innovation space. You guys just launched something that's very interesting. Give us like the scoop on SoftWave Therapy. How does it work? How does it work with the chiropractic therapy you guys offer now, and kind of give us the breakdown on it?
All right, loaded question there, but we'll get into it. So SoftWave is a specific device that we have in the office. It's a form of shockwave therapy. So if you do any research on it, you're most likely going to see the shockwave is what they're referencing. Now, what this therapy is, it's a machine, looks like ultrasound, but what it does is it creates a spark in the machine that creates an acoustic impulse, so a sound wave that goes into the joint. As it passes through normal tissue, let's say we're treating a shoulder, for example, as we're mapping over that shoulder, if it goes through normal tissue, you don't feel anything at all. What's happening is that sound wave is being transduced through the tissues. Normal tissue cells bounce back and reflect that sound wave, and there's no difference. If it goes through something that's irritated, you have scar tissue, inflammation in the joint, maybe damage to the bone or ligament structures, you're going to feel an uncomfortable ache in there. So what it's doing is it's essentially breaking up that scar tissue, clearing out those dead senescent cells, and making way for new healing to come in. So it's going to promote your blood flow up to 300% is what the research is saying. And then it's also going to help modulate the inflammation response. So you have your cytokines, all those other inflammatory markers that are produced by your immune system there that go into the joint, and the weeks to months coming after those treatments, your body's actually going to transition from saying, hey, this is a chronic injury that stopped healing, to something that we need to address. So it's going to start sending stem cells to the area to actually go in and heal, make new tissue cells. So if you're familiar with anything in the regenerative space, kind of the lower entry level is PRP injections,
Yep.
where they're spinning the blood plasma, sending it in there. And the whole idea is that it's going to turn into stem cells and
Right.
heal the joints. The next level up is stem cell injections, which work great, but they're extremely expensive. You're looking maybe $8,000 to $10,000 for an injection that you have to go do every couple months, and that can get very costly for people, but it does get good results. The benefit to SoftWave here is that, one, it's clearing out the joint of all the bad tissue first, helping promote that healing naturally, and then your body's promoting its own stem cells, so it's not coming from embryonic tissue or some foreign source. It's your own stem cells from the bone marrow going to that joint and going in and healing it. So the big thing is it's clearing out the path, almost like leveling the garden for the plants to grow, and then the new cells come in to actually make the healing and heal that tissue cell. So it's really exciting technology. A couple things I wanted to touch on. historically, myself and Dr. Brady, we considered ourselves straight chiropractors, which means that all we do is chiropractic. We stick to our lane and that's it.
Right.
But over the years, we've just seen, we work with a lot of athletes, a lot of people that have had really chronic injuries, that we have limitations to that matter because the body can't just clear that scar tissue very easily. You have to go in and break it up and do other things. So we were looking for another source for our patients to really go in there and get better results. So we tested a couple different units of SoftWave Therapy, and the SoftWave is hands down the best. It creates a more focal wave, so you're treating a bigger area while it still penetrates really deeply into the skin. It goes up to 12 millimeters deep into the skin, so you can get deep tissues, hip joints, shoulders. It's really great for tons of conditions that people really struggle with chronic injuries for.
And it's for everybody, right? You don't have to be an athlete
to
come do it, right? Like anyone, is this like a first option of therapy, or are you guys, doing kind of your chiropractic, then you're isolating and saying, hey, you know what, you'd be a great candidate for this? Can someone come to you just for like the SoftWave Therapy? Like who's a good candidate, or how do you guys figure it's a good option for someone?
Yeah, absolutely. So they can come in and start with either. We have opened this up exclusively for our in-house patients first. So they were all chiropractic patients. Some of them maybe have disappeared for a couple months or so. And when we sent out our text message about the new therapy, they were interested because they're like, man, I've really had this chronic shoulder injury that isn't healing. I want to go try that. So we made a great offer for all of our patients to come in and test it out, and we've seen phenomenal results. So ideally, we want people doing both. If they're a candidate for SoftWave, what that looks like is someone that has a subacute chronic injury that's just not healing well, or maybe they're pre-surgery, they want to avoid the surgery, or post-surgery where you're definitely going to have scar tissue in the joint. So anyone that's kind of got a chronic injury that just keeps nagging them, that doesn't heal properly, that's a great candidate for SoftWave.
So it's a great point, because we have a ton of athletes that are coming post ACL. So if someone had ACL surgery, this is a great option for them to come to you guys, help break up some of that scar tissue, bring more circulation in, and let the body's like natural kind of powerful, kind of process do its thing and help speed up the recovery. Is that right?
Absolutely. And the immediate effects, people notice right away, even after a single session. Their range of motion improves, pain significantly decreases, because as we're mapping through that area where they tell us that tender spot is, we want it to be uncomfortable. We want it to be about a 5, 6 out of 10.
Yeah.
And as you were going through, continuing over that area, they'll be like, oh, it's down to like a 2 right now. Like I can feel the difference. And then immediately after, we're testing them and their range of motion improves. So it's really exciting for people because they can see the difference right away. It's not something where you're like, I really hope this works in 6 to 8 weeks. It's something every time you come in, you're going to notice a difference.
Right.
And then the weeks after is where those stem cells are really coming in and really cementing in the healing process there.
And it's interesting because chiropractic care, and particularly like something that you guys do in the Gonstead, therapy, it will take some time, right? I felt immediate release, but one of the things I remember when we were talking earlier in our treatment, you made a very, very big point. You want to make sure for the first couple months to be very regular so that the alignments kind of, get into place. A lot of people give up on chiropractic care because it's like not immediate results. So this is kind of the best of both worlds. This is for someone who has the patience and the time and listens. And when you say, hey, look, it's going to take a couple months when we really see this problem get better by 80, 90%. And then now you guys have something that can almost be immediate results, immediate relief. And I think that's something that people are not patient about. In society these days, everyone wants immediate results. Like they want it to feel good, like now. Like they want to come in, they want to walk out. Can you kind of destigmatize like that? Because this is something that we've talked to some people about, and they feel that a lot of chiropractors you go to, they feel like they're being told that they have to come for many, many months because it's a money tactic. But explain how it will actually help calm the nervous system down. So coming for one session, it feels good. Your nervous system kind of takes a little bit of a break, but then it's not completely gone. And then with SoftWave Therapy, like the nervous system can really kind of calm down and stop sending those signals.
Yeah.
Can you like go into the difference between immediate results and it may take some time?
Yeah. I'm going to use an analogy first back to the gym. So what would you say is an ideal frequency for someone to go to the gym?
If you're wanting to get good at something and be fit, I'd probably say at least 4 or 5 days a week.
4 or 5 days. Yeah. So that's more frequently than what we recommend for people to come in here. But the reason behind that is you have to retrain those muscles. You have to strengthen the ligaments to actually break down and repair that tissue to have that new level of strength and flexibility. The same is true with the spine. Anytime we're making an adjustment, you got muscles and ligaments attached. Yeah, a lot of times we get people immediate results right away. And that's what we want. We want to help people. We want to get them out of pain. But that's almost one of the things I hate the most is when someone comes in and they're in terrible condition and they get immediate results and they think they're good. Because then they're going to come back in 3 weeks and be like, it's worse. I'm like, yeah, because you didn't listen. We have to get you to that point of being stable there. And that's how the body works. It's not a money tactic. Believe me, if I could teach someone how to stretch and adjust their own back, I'd be sitting on a beach sipping mojitos and teaching an online course. But it takes frequency. It takes time for the body to make the healing there. So that's why when someone comes in, we have individual recommendations. It's not a cookie cutter approach for every person. It just really depends on a couple things: your age, what kind of structural, biomechanical things we have to achieve, and then what symptoms are we trying to resolve there. So those are kind of the things that taper into our recommendations. But yeah, certainly in the beginning, we're usually seeing people a little more frequently till we get them to the point of stability, and then we give them the corrective exercises, things they can do at home, because I want people to be independent. I don't want to have to see you all the time, but it does take time to get the healing.
Yeah, that's true. I mean, a pregnant woman is going to be a different treatment than, say, like somebody who's a professional athlete, right? They're going to have different frequencies. I want to dive into something that when we were researching how to really kind of dig deep in like this type of medicine that you guys practice, what are some common issues and like real examples? What are common issues you see in strength athletes and like specifically strength athletes? Because I think everyone, it's a big buzzword lately, like strength, resistance training, and strength it's a hot commodity, and that's great. It should be. Everybody can do it. Anybody can go to the gym. But when people go and they don't know what they're doing, or they go, a little bit too drastic in like their training, a lot of people get hurt. And I've been doing CrossFit now for coming up 7 years, and even to this day, sometimes doing very repetitive, programming, I will get hurt. And for something I've done probably 1 million times now. What are the most common issues you see in strength training athletes, in soccer athletes? How does that relate to soccer, basketball? Kind of what's the most common thing you guys see?
I'd say a lot when it comes to athletes or someone that's strength training is overuse injuries, tendinitis, whether it's coming from stress in the knee, the elbow, or shoulder joint. Tendinitis is a huge problem for people. And ultimately, that's just one, the joint isn't properly aligned, or your biomechanics during your exercise aren't ideal. A lot of people, especially if they're in CrossFit, they're competing to stack higher weights, get faster times, and your form breaks down over time. So that's where what I understand in a competition setting, you're going to have that. It's kind of unavoidable. But if that's happening day to day in all of your training, we got a bigger picture that we got to look at. We got to figure out, is there something that's breaking down in your form? Is there some kind of alignment in your spine where this exercise might not be suitable for you? We have to do some kind of adaptation to make sure that we're addressing this imbalance. So that's where we take a very thorough approach when we're working with athletes to really determine if there's something that's flaring up, what other exercise can we do? What other accessory movements can we do to help alleviate this so you can continue training and not have these constant flare-ups? Because I'm an athlete myself. I've had my injuries, deadlifting, squatting, I've been through it all as well. So I understand what it takes to get back to that. I understand the adaptations that I need to make in my routine to make sure that I'm not having those injuries come back up again. And that's the same thing that we want for all of our athletes as well.
Yeah, I mean, and you just hit a really hot point. You are a doctor, and you're basically saying it's okay to adapt, and it's okay to make, adjustments. So many times we'll see programming that's written specifically to the T, and there's a little bit of a stigma where in order to hit programming to be considered elite or an RX athlete, you have to do it. But sometimes there's a movement that's just going to hurt you, and it's just not worth it. And I believe you said you do MMA. You were doing
Jiu-jitsu.
Yeah. So jiu-jitsu, there's a lot of falling. There's a lot of different impact to the body. And obviously strength training also does a huge different impact, especially when you're doing hard, lifts and barbell movements. As a doctor, like, what are some adjustments that people can make so it's less likely for them to maybe deal with some of these injuries?
Yeah. So in high school and college, I was really into the bodybuilding world, wanted to be huge and lift heavy weights all the time.
Yeah.
And I'll tell you, I felt like crap because I was so stiff all the time, having constant injuries.
Yeah.
I didn't focus on the mobility aspect. I did take my nutrition seriously, but there's other things that I wish I would have incorporated earlier on. So there's lots of different aspects to that. It's kind of a loaded question, but I think you got to just look outside your sport. What are the other things that you're doing to help promote your recovery? Everyone should be doing some sort of mobility and stretching, taking their diet seriously, especially as a high-level athlete. When we're young, we can kind of sacrifice those end of things, and you're a little more pliable. You haven't had the injuries yet, but as soon as that stuff starts accumulating, you really have to step back and look at how can I prevent this from happening again or prevent future injuries, because if we're not looking at the whole picture, then it's going to happen. Every athlete has their setbacks.
Right. Yeah. No, that's good. That's a good point. I just always feel like, you go to see a practitioner and people always just ask direct questions like, what are some adjustments I can make? And there's always this like awkward pause and this very sweet slide around the question. And they just kind of say, well, you know what, just see what works best. And, the more people can get into the gym, the more people that can work out, I think the more people can be mobile, the better. And I think there's a lot of people that are like afraid to go into the gym because they don't want to get hurt. And you brought up a good point, preventing future injuries. What are the biggest recovery mistakes that you see that athletes make? And people who maybe aren't serious athletes, but they're trying to be more fit.
Yeah. So one of the biggest mistakes, I think, is they jump back into the game too soon. If you're a high school football player and you got playoffs coming up, but you have a serious strain on your ACL, don't jump in the game. It's not worth. I hear this every day. People are just like, man, yeah, I really pushed it in sports when I was young, and I wanted to get to college, but then that injury just sidelined me, and now I'm paying the price for it for the rest of my life.
Yeah.
So they can't even walk now. So that's where take the time to do the recovery, have professional help, whether it's a chiropractor, a PT, a good trainer that's actually breaking down your form and not just giving you a scripted set of exercises, because every person is different. So the recovery aspect is huge. Just making sure that you're maintaining your health, you're progressing with flexibility, steady movement, not just focusing on one exercise. I think that's a big fallback in youth sports nowadays, is a lot of parents are like, my kid's the baseball prodigy. He's going in baseball, so we're doing baseball all year round.
Yeah.
Well, if you look, college coaches don't even want someone that's pitched before they get to college because they have so many injuries by the time they get there.
Yeah.
So having an all-encompassing routine where whether it's just stretching, strength training in your one sport or doing multiple sports, I think it's extremely beneficial for children, especially.
Yeah. So it's I love what you just said. Overtraining and getting back into a sport or getting back into like the rhythm of it, it's such a huge problem. A lot of studies are going in right now. So FIFA, the governing body for soccer's funding studies for women and ACL injury. Well, a typical elite athlete right now at basically the age of starting around 11, 12, will have played roughly anywhere from 45 to 50 games in a span of about 3.5 to 4 months. That's not even counting 3 to 4 trainings a week, right? And then you've got a lot of parents that my kid's the next prodigy. They're going to go Division I, NIL, they're going to go pro. They're layering on top of that private training 2 to 3 times a week. And then on top of that, they're doing like other auxiliary training. And you look at like a kid and think about kids maybe like 20 years ago, they have no time to recover. They have no time for their bodies to grow, their muscles to recover. And that's like such an important thing, is overtraining and jumping back into something when they do feel that they're fatigued and hurt is such a big problem. What is like your biggest kind of like performance changes you've seen, and maybe someone who is a very serious athlete and someone who's not? Like, give us like a crazy or maybe like a really inspiring case that you've dealt with personally. Somebody coming in, they were in a very bad place or in bad shape, and either the Gonstead therapy that you practice, and maybe one with the SoftWave that you guys have had great success in.
Yeah, I want to backtrack a little bit. There was a point you made about all the hours they're putting in there, how many games they have. Especially as a young athlete, it's a ton of pressure. So one thing we never talk about is the mental toll that takes on someone. And growing up, when I was wrestling in high school, I had a teammate who was phenomenal, probably one of the best wrestlers I've ever seen. The kid trained multiple times a day. He would go to a wrestling match, didn't get good enough workout because he just destroyed the kid, and then he would go train and do 2 practices that night. And you just saw the effects of the burnout with him over the years, and I think that's something we don't really consider as parents, is like, does the kid even want to go through this? Are they that committed, or is this something you're pushing on them?
Yeah.
So one, we got to look at the mental toll it takes on kids as well. We're not allowing them a chance to sleep enough or heal enough, so that's a huge aspect of things. But yeah, to your other point there, we've had some really cool cases with athletes here in the office. One of the females I take care of, she's really high level into CrossFit and stuff, and she had a severe shoulder injury, had a labral tear. This was before we had SoftWave, so we were exclusively treating her with chiropractic, adjusting the spine, the scapula, which is often overlooked in shoulder conditions. And she was able to heal and have full range of motion in her shoulder. And now that we have SoftWave, I believe she's starting that as well. And that's just that extra edge where it's like the healing's on steroids now. She's back to like 100%, going to be doing competitions again, where she was completely changing up her training. She wasn't lifting heavy anymore for a while, started getting into cycling and stuff just because she couldn't do what she loved. And you just see that take a toll on a person mentally when they lose their passion. I think that's the hardest thing for athletes, especially when they're competing or working towards that goal of getting to that really high level, is if that goes wrong, they have an injury or a setback, it just derails their entire life. So that's why it's extremely important. I think people really need to focus on the prevention and the recovery so that doesn't happen. And yes, it might take a little longer to get there. You're not training quite as hard, but you're staying in the game longer.
Yeah, but I mean, you bring up such a really good point. For me, I've had bouts of the mental health aspect of just like being in a good place where you just be happy and be content. And training is my first form of medicine. Minimum of 4 to 5 days a week, and it's got to the point where the CrossFit is super exciting. It's really, really fun. At my age, I'm not going to go pro. I'd like to say that I get excited when I'm in the top of the 5 like leaderboards sometimes at our gym. But I also like now that I can comfortably go play pickleball like competitively like 2-3 times a week, or go play men's league soccer a couple times a week. And when I had the injury, the biggest thing for me was you sit out for a couple of weeks to let it recover, but then, you start getting the blues. Like the depression starts to slowly hit. You can't understand why you're in a funk. You're not excited to do anything, and you're just not getting that same kind of like the adrenaline, the dopamine from the working out. A lot of runners will say they get the runner's high from the running, and people just don't do anything. They just stop. So you mentioned something super, super important. If you do heavy lifting and you can't lift heavy anymore, it doesn't mean you should stop. You should still do something, whether it's cycling or whether you can go play pickleball or whether you can go like walking, rucking, whatever the case is. But you guys help people kind of get back into it way quicker, and you'll come in and say, hey, look, like, don't do a 180-pound push press, but maybe you can do like a 90-pound strict press, something lighter. Start here. This is your trigger point. So a lot of people can come in and you can walk them through like, okay, you can still do this. Don't completely stop, and let's just see how it is, right? Yeah. So people don't just stop losing the passion and the drive.
Yeah, and that happened to me. It was in December. I injured my wrist in jiu-jitsu. I could hardly adjust with my right hand for 3 weeks, and I'm doing all the things that I would recommend my patients do. I'm putting the therapies, the oils, everything on it, getting it adjusted, and it just was a slow heal. And that's right when we brought the SoftWave in. So as soon as I brought that in,
you were using it like from the get-go. You were telling me,
yeah, it was 2 treatments, and I'm back to 100%. I haven't had an issue with it since, which is insane, and that's what really changed my mind on this therapy, because I'm really skeptical of a lot of the therapies out there. I think the cost to benefit ratio isn't worth it, and that's why I just stuck to chiropractic for the longest time. But when we tried this, I was like, no, this is legitimate. It's helped me through several injuries already. So
that's cool.
It's an awesome tool. But just to kind of piggyback off that point you were making, when I've had injuries in the past, or I couldn't lift as heavy as I want to, maybe my shoulder was strained, then I'm focused on my mobility or my other things. So I think people just need to find other tools in their toolbox, and who knows, you may love that and you want to continue and add that in your routine, and it's going to benefit you overall. But to just stop completely and not do anything is probably one of the worst things you can do. Well, even with an ACL tear, for example, something that's not talked about in the therapy world is, you got to rest. You obviously can't work that leg until you have some degree of healing in there, but people stop training the other side, and that's a mistake. So there's actually neural crossover when you're training that opposite leg that can actually cross over to the other side and help promote the healing and keep some of your strength in the other leg. So it's kind of a hidden gem that no one really talks about in the therapy world. I've only heard a few practitioners mention it, but it's a key thing that athletes don't stop training altogether.
I've listened to a ton of podcasts and a lot of, the health space. I've never heard that reference before. So it's super interesting, because you'll also see people who will break their legs and they'll be in a cast and they take their cast off, and the muscle shrinkage is so crazy. And they're literally told to stay off of one leg, but people stop completely. Like they just, they feel like
sit.
They just sit. They just don't do anything. Yeah. I kind of want to touch up on something you just mentioned too. You were talking about a lot of like athletes and like regular people that are coming in and whatnot. Can someone come in and say like, hey, I am not mobile, I am not working out, will you guys steer people in the right direction on how to become mobile again? Because one of the things that you mentioned to me in the very beginning was, and this is why I came to you when I had my previous chiropractic care, they told me to stop basically doing the lift and stop going to the gym for months. You had mentioned something to me about stay mobile and keep moving, because it will help the alignment and the adjustment of the spine in the specific areas where my injury is and was. So kind of explain how somebody can come in and they can tell you like what their problems are, and you can at least tell them like a general direction of programming, like what they can do to make it better.
Yeah, I'd say one of the things we get often, I just had this today, it was a guy that's from out of town, or the other day, he came in from out of town. He was in really bad shape. He wanted to go skiing over the weekend and injured his low back. He couldn't even sit down. So I was like, all right, we'll do what we can. We'll get you adjusted here. So we got him adjusted. He's like, man, I'm like 80% better right now. I was like, well, you need to come back one more time. We're not done yet. Like, if you want to be skiing, trust me, you got to come back. And he came back the next day. He's like, yeah, I did get a little sore. Like, you're right. So he came back in. We adjusted him again. He's doing much better, but he wanted to know right away, like, what kind of exercise can I do? What can I do this? And he was asking me this before I had even examined him or took the x-rays. And that's why that's such a crucial portion, is because everyone's completely different with their structure. One stretch does not work for every person. Certain stretches should be avoided for certain people, because it's going to cause problems. So that's where when we take all those pieces, we're looking at the x-ray, we see what's going on with them, we'll make those recommendations on what exercises or stretches to start with to, start slowly building that back up. And a lot of athletes, when they come in, they're concerned, like, well, do I have to stop lifting like altogether? I'm like, no, I just don't want you doing this exercise right now. You can do these other things. Let's work around this, but I want you to add this in your routine to help get better movement through that part of your spine or the extremities, whatever's bothering them. So we're always trying to put the pieces together, do something, meet people where they're at to where we can get them progressing faster. But the last thing I want someone to do is just sit around, because I'll tell you, from all the people we see in the office, the worst spines are the ones that work at a desk for 8 to 10 hours a day.
Yeah.
They're constantly tight. They have no muscle mass. It's just like things break down, and that is the worst thing you can do, is just sit all day. So I want people moving. I want to give them direction on their exercises, and that's my favorite kind of patient. That's why I like working with athletes, is because they listen. They actively look at things that they can do to actually improve their health. So they respond the best.
They're used to the coaching.
Yeah.
So I kind of want to get into, how can parents identify when care is needed, and, also touch upon the growth spurts and like younger, kids, and how growth spurts is a sign that it's a great time to come to you guys, and what you guys kind of help with that.
Yeah, I think parents, it's really easy to identify when your kid has something that's functionally wrong or they have an injury. That's the obvious. They always take their kid in at that point because they want them feeling better. But I think the more important thing is being preventative. Like, even if your kid's got nothing going on, just take them to a good provider to have them examined. I think everyone should have an x-ray of their spine, because it's a crucial part of your health that tells you so much about what's going on under the surface that's often overlooked. So I think the earlier that happens, the better. You don't need an injury to go see a provider. That's our favorite patient, is that someone that comes in and just wants to be preventative with their health, because they take it seriously. As far as the growth spurt, obviously when kids start getting to that age of puberty, they start shooting up, they're growing, everything's growing rapidly there, and that's where, like we hit on scoliosis earlier, the old school measure of detecting scoliosis was bend over and touch your toes and see if we have a curve there. It's not accurate. I got people that have been told they had a scoliosis. They thought they had a scoliosis for 15 years. They come into the office, their spine is straight as a toothpick.
Yeah.
And then you got people that were never told that, because when they flexed, the spine straightened out, but then they come back up and they have a scoliosis. So it's not a good measure. That's why we need diagnostic tools, imaging, things like that, to really paint the picture and see what's going on under the surface.
And so, like, how does that consistent care support year over year development? So someone comes in, say at the age of 8, and then now they get into that pubescent age, and then they're going through that high school age. Like, what does that year over year development look like?
Yeah, so we take lots of follow-up re-exams and follow-up x-rays through the years there. It's not something that it's extreme. We're not doing it multiple times a year for people, but when we take those follow-up x-rays, more often than not, I would say the majority of the time we're seeing improvements on the x-ray as far as their structure. If not everywhere, then in certain areas. And if there's a certain area that's not responding, that's when we start asking questions. Okay, what's going on? Why is this area not responding? What do we have to change in our treatment to make sure that we're getting results there? What kind of exercises, other therapies can we incorporate to make sure that over the years they continue to improve? Because once we have degeneration in the spine there, historically there's nothing that can regenerate that disc. I don't know about stem cell and SoftWave. We haven't seen tons of research on that aspect of things yet. But once you lose that, you can't ever get it back. So that's why it's so important to maintain it and stay healthy for as long as you can. Because one of the main things when I'm showing people x-rays is what I hear every day. They're like, oh, yeah, is that just because I'm getting old? Like, look how bad that one is. Right. Well, guess how old that bone is? It's the same age, and it looks perfect. That one's the bad one. Yeah. So there's something else going on under the surface. There's biomechanical issues that are causing one to wear down faster than the other, because age is not an excuse for becoming unhealthy. Yeah, and what happens to that person? That person will go to a regular Western medicine doctor, which some of them are great, and then they'll get referred to a spine specialist. And what does that road lead to? That leads to, and I want you to touch up on this, because this is such a huge kind of like
conflicting like therapy and treatment, but disc replacement, right? And how effective is disc replacement, and why people should always come to you guys first and exhume all the options here and exhaust what you have before that.
The first thing I want to touch on with surgery, what they consider a successful surgery, is the surgery is completed as designed and the patient didn't die. That's basically the bottom line of what constitutes successful surgery. It doesn't mean that the symptoms are gone. It doesn't mean that they're functioning better. So if you look in the research, there's tons of research on low back surgery, for example, where, yes, patients did report improvement in pain reduction, range of motion, but if you look at the recurrence of surgeries down the road, it's really high. I've seen as high as 60 to 70%.
Yeah.
Because what's essentially happening, if you're just doing a disc where they're shaving the disc, you're basically accelerating the degeneration of that disc.
Right.
Yes, you're taking out the bulge, so it's not impinging on the nerve anymore, but now that disc is now 10 years older than what it was before. So you've already accelerated the decaying process there. Worst case scenario, they're getting the full cage in there where they have the metal rods. That just destroys someone's mobility in their low back, and then all the other areas above and below that have to make up for that lack of motion. So that just cascades the effects of degeneration even farther. So it's something that in some cases, yes, it's necessary. It's great we have that technology, but most of these surgeries can be avoided. And that's where, yes, it's uncomfortable. It's annoying your life now, but I promise you, if you go down that route, you're probably going to have way more problems in the future, even if you get a few good years of no pain. But it's not worth the risk of the lack of mobility and things that you're going to see later on.
And do you guys get people that come back post-surgery from back surgery and say, like, I did the surgery, I was out for 6 months and it helped a little bit, but it didn't help?
Every single day. Yeah. We got tons of people that have had low back surgeries, neck surgery, and they'll come back and say, I didn't get any relief, or it's worse. That's why we want to avoid this at all costs. That's why with the method that we do and including the SoftWave, I'm more excited than ever, because we're seeing results with people that, you know, they have tons of scar tough cases to get over the edge. But now with this other technology, we're seeing amazing results.
Cool. Well, that's really, really good. We're going to do a couple of closing thoughts. So one piece of advice for competitive athletes and one piece of advice for just us regular, simple people that are trying to stay fit.
All right. For everyone, I'm going to include everyone on this.
Yeah.
Take care of your health. Do all the right things: diet, nutrition, exercising. Everyone should be doing it. You should be getting your spine assessed. It's housing your nervous system. I'm not just pitching it because I'm a chiropractor. I do it because it's what's kept me in the game. I wouldn't be mobile or active if it wasn't for that. So doing all those things, getting enough rest, taking your mental health seriously, it's important for everyone, but especially for athletes. You really have to have a good team behind you. Whether it's the parents that are coaching their kids or you're an adult athlete, I think you just need a good support system of healthcare providers to make sure that we're taking care of the bigger picture, keeping you in the game for as long as possible. Because when it's your passion and you can't do it anymore, it's really hard for people. So.
Yeah, no, that's a really good point. What are common misconceptions about chiropractic care?
Okay, probably the biggest misconception is that it's about pain relief. We hit on that earlier. It's about nervous system optimization. They're making sure that your nervous system is functioning without interference there. So that is the bottom line, and that's why we see cases far beyond back pain and neck pain. We see infertility, people with digestive issues, asthma, all these things that respond great to chiropractic because we take that extra measure to figure out where the nervous system's being stressed. So that's the biggest misconception, is that it's simply pain relief. The second one is that it's not safe for kids. We see babies that are days old in the office, and they grow up and develop normally, and they do great with chiropractic.
And I trust my kids with you. So, and I wanted to point out, when we walk in here, one, the clinic looks super welcoming, very like modern. And then as we walk through the whole clinic, like, we see more than just adjustment tables. You guys are a recovery practice. You guys have the SoftWave Therapy. you have multiple different adjustment tables and surfaces to kind of get to different, treatments. You guys also have, we just talked about the Normatec compression sleeves. You guys have the specific massage tables. You guys have like a whole stretch cage. Like, where's the sport performance and recovery care heading, and how you guys are bridging recovery wellness all together, like and all in one?
Yeah, so I'm really excited about currently where sports performance is going, because you got all these biohackers, all these people that are influencers that are finding new technologies, things that help people. And those are all things that historically me and Dr. Brady have used. And we're like, well, why would we not offer this for our patients? If we believe in it, obviously it's good. So that's where Dr. Brady is the clinic owner. He's coming in and bringing in a lot of cool stuff for our patients to utilize. We have a whole patient lounge out there, the recovery lounge, where they can go in and use the massage tables, the Normatec red light therapy bands to help promote their recovery. And they can do that anytime outside their appointments. So it's really helped a lot of our patients. We got people that are here daily using that stuff. So
cool.
It's really cool to see people use that. And
I
see
didn't
the
know
benefit
that.
in it.
I would be here like more times a week if I knew.
Well, now you can.
Yeah.
And then, with the SoftWave, that's just another tool that we brought in. Just we want better results for our patients. And with anything that we believe in, that we see a value in, we want to bring it in so we can get the best results for everyone.
Awesome. That's cool. From your perspective, and I know this is like a touchy subject, I just want to ask like your angle on this. What are like 2 or 3 really easy supplements or something that people can maybe add to their diet to really help the spine or the nervous system that then maybe can cause some of this inflammation around the spine? Like, one of the things that I know I suffer with is hydration and drinking enough water. The discs obviously in the spine are made up of fluid, and that's a big piece. But from your perspective, from you being up in the science, is there any like specific vitamin or mineral or supplement that you say, hey, you know what, like this could help in certain cases?
Yeah, great question. One of the first ones, it's one that's been on my mind recently because I see a lot of new information coming out on it, is creatine.
Yeah.
I've always used it training and weightlifting. Took a break from it for a while, and then recently I've been reading so much on it about not only the benefits with sports performance, but brain health.
Sure.
People saying that doses as high as 10 grams.
10 grams.
10 grams
Yeah.
helps promote brain health. Like
Right.
people that are sleep deprived, they'll function better on creatine, even if they're sleep deprived, than someone that had a full night
Right.
of sleep. So that is hands down one that I'm definitely pushing and actually using myself.
Yeah.
So I'm a huge believer in that. And then just, I think, especially for athletes, making sure you have good protein, you're getting the things that you need for recovery. Everyone should be taking a decent multivitamin if they don't have a healthy, balanced diet. I always push people, natural is better. If you're eating whole foods, that is hands down the best route you can go. But if you can't find a good multivitamin where you're getting some of those extra vitamins and minerals. And then in the office, we're a big fan of Element as well.
Yeah.
Not an endorsement for them, but I do
we're-
love the product.
we are Element guys ourselves. So, we do know a lot of the society is probably dehydrated, and people think drinking your ABC, purified water, it's not hydrating. There's no minerals in there. It's stripped down water. You're going to the restroom and you're just putting, that back into, like the bathroom. There's absolutely nothing really typically hydrating your body. Element's a great
If you look
tool.
at some of the other competitors, just look at the back of it and see what's on it. A lot of them have sugar and really nothing of value in there. So they have great marketing. A lot of people are drinking them, but Element's one that actually has good stuff in it. So.
Yeah, and we're not saying that because we want to be sponsored, but we wouldn't mind. Okay, so what does longevity in sport truly come down to? And again, this is broad. Like, we're talking anyone who's not, that serious, or someone who likes to just be happy. A 7-year-old who walks their dog 3 times a week, that is them being fit. Like, what does the longevity really come down to, like, in your eyes?
First thing's consistency over time. A lot of people, they decide they get into a sport and they want to be the best at it, and they overtrain and they're pushing themselves too hard. You got to make the small steps and build it up smartly. That's why it helps to have a coach that has a plan for you, and so that you're progressing over time. Not everyone can be a star overnight. Yeah. But the other thing is just staying in the game as long as you can with as few risks and injuries as possible. So that's where all these things we talked about today help you do that.
Right.
So
that's cool. Yeah. So I know you guys have spent a lot of time, a lot of your efforts, and you guys have like really, really brought the SoftWave therapy and treatment into your clinic. You guys want to kind of offer an introductory kind of treatment option, kind of give our listeners and some of our partners an idea of what that introductory offer is. How can they get to it? We'll put a link of how people can access it through the podcast, but explain what the offer is and how like it would go from start to finish.
Yeah, we want to do a couple different offers for anyone that's listening. First one would be if you are interested in the chiropractic end of things, experienced in the Gonstead method, we'll do your first neurological evaluation, full spine x-rays, and treatment for $49, so great value there. Second one would be if you're interested in SoftWave, we'll do your first assessment there, our mapping session where you choose 1 to 3 regions of complaint there so we can really map through and figure out what's going to be the most effective course of treatment. And we'll do that. Any other x-rays that are needed. So if you have a shoulder problem, we'll take x-rays on the shoulder, see if there's any issues with the joint. We'll do our full examination and the treatment for $49 as well. So people can kind of choose what route they want to go. If you're someone that's interested in both, let us know that, and we can come in and do the full assessment and all the necessary x-rays that we would need to do and do your first treatment, and then kind of show you what it would look like if we do a combination route. So that would be great for anyone that's listening. The other thing that we want to offer, I know you partner with a lot of gyms and athletic organizations there. So if there's any gym that is interested in experiencing SoftWave, it's a mobile unit, so we can bring this to your gym and we'll kind of bring it to on site there, do a treatment for all of your athletes that are interested in trying it out. So we can set that up on a weekend or any day that works with our schedule here, where we come out and do the treatment so your athletes can experience what kind of results they would expect.
That's big. Being mobile and being flexible to come to the athlete is super important. How can people find you guys? Where are you guys located? What's the best way of getting a hold of you guys?
All right. You can find us on Instagram. We have Concise Chiropractic is our handle there. ConciseChiropractic.com is our website. If anyone's interested in just reaching out to me directly, my email is drcolton@concisechiropractic.com. So you can reach out to me. I can answer any questions you have, or just call our office here. I'll give you our phone number, 720-255-1043. And then we are located off of Arapahoe Road and I-25 in the Wells Fargo building next to Target there. So we're on the 3rd floor. But come check out our clinic. We'd love to show you around. It's a beautiful new clinic we opened up in September, and we're just adding more and more things. So
awesome.
We're excited.
Colton, thank you, man. This is great. We've been trying to do this for a while. A lot of awesome information. We'd love to have you back on sometime soon. Thank you so much for sharing your knowledge.
Thank you.
You've been listening to Uncomfortable by Design. If it made you think, good. If it made you uncomfortable, even better. Follow the show, leave a review, and we'll see you next time.